So now let's talk about the major clinical syndromes that CMV can cause. So the three main ones are infectious mononucleosis, congenital disease, and disease in immunocompromised hosts. Now, Epstein-Barr virus, or EBV, is the most common cause of infectious mononucleosis, or mono. So we're going to talk about mono when we talk about EBV. But just remember that CMV causes almost 10% of mono cases. So let's move on to congenital infection. And that's actually potentially much more serious. So congenital infection happens when a pregnant woman gets a primary CMV infection or sometimes reactivation. And I'm sure you've heard of Down syndrome. You might have heard of spina bifida or fetal alcohol syndrome. But what you probably don't know is that congenital CMV is more common than any of those. And that's probably because pregnant women are so often exposed to young kids who can spread it to them, and also because CMV can cross the placenta. So 1 in 100 babies in the US are born with CMV, and of those, 1 in 5 is going to have symptoms or sequelae. And the disease can range in severity from mild to fatal, but possible signs of congenital CMV infection at birth include premature birth with low birth weight, hepatosplenomegaly, respiratory distress, microcephaly and seizures, and a petechial or purpuric rash. So that's all stuff you might see at birth. And then long-term complications can include intellectual disability, vision and hearing problems, seizure disorders, and problems with weakness and coordination. So finally, let's talk about CMV in immunocompromised hosts. And the issue is that in transplant recipients receiving immunosuppressive drugs or in advanced HIV infection, CMV can reactivate and actually cause serious illness. In fact, CMV is probably the most important post-transplant viral infection. And when you do a transplant, you actually always assess the CMV status of the donor and the recipient, because that's going to determine the risk of CMV disease and also the monitoring plan for it. So what kind of disease does it cause? Well, CMV can cause fever, pneumonitis, hepatitis, colitis, lots of itises, as you can tell, as well as transplant rejection, and it can actually precipitate graft versus host disease. Now, in advanced HIV disease, CMV can also reactivate. And when we say advanced, usually it's when the CD4 count gets below 50. And in that case, CMV is most likely to cause retinitis, which can lead to blindness. And this is what the eye might look like if you looked inside it relative to a normal eye. So it can cause retinitis or colitis or esophagitis. And so these are all the main complications of CMV that you need to know.